negative breast cancer, treatment is especially challenging. Joining me from Washington to talk about breast cancer, especially triple negative breast cancer, is attorney and patient advocate Erica Stallings. Thank you so much for being on BNC Live, Erica.
Thank you so much for having me this afternoon.
So before we talk about this triple negative breast cancer, can you talk to us a little bit about your own experience or near experience with breast cancer?
Yeah, so I carry a hereditary mutation that is known as BRCA2, and it is a mutation. It can be passed from either parent to a child, and it significantly elevates your lifetime chance of developing breast cancer. So my mom is a two-time breast cancer survivor. She actually was diagnosed with triple negative breast cancer the second time she had breast cancer. And that's when she learned that she has a BRCA2 mutation. And a few years later, I learned that I carried that same mutation as well. So about almost 7 years ago, I underwent a preventative mastectomy to reduce my chance of developing breast cancer from about 80% to less than 5%.
Wow, that's scary, but that's, a tough choice to have to make, but also one that a lot of people are faced with these days. And this BRCA gene, if a woman tests negative for any mutation, is she sort of in the clear for breast cancer in the future?
No, that's an excellent question. So I think something that's really important, particularly for Black women, given how vulnerable we are to breast cancer, is to understand that there's really three categories of risk. So the first is what we call sort of like the baseline risk. Right now, average risk of developing breast cancer in the United States is about 1 in 8. And then the next category of risk is what we call familial risk. So if you have a mom, a grandmother, an aunt, or uncles, grandfathers who have had breast cancer, different types of cancer,
Hmm.
you have an elevated risk of developing cancer over your lifetime because of that family history. And then finally, in the final category, you have people who have the hereditary or the genetic risk. So they've tested positive for a mutation. And those mutations include BRCA1 and 2, Lynch syndrome, and CHEK2. So I would never say to anyone that just because they don't carry this mutation that they're out of the park. And one thing that I think is really important, again, particularly for members of the Black community, is to have conversations with your family members about what the past history of different types of cancer have been.
And it's so important. I don't think a lot of people make the connection that any type of cancer in your family line could make you more susceptible to have any other type of cancer. It doesn't have to be the exact same one. So thank you for clarifying that. But now I want to talk a little bit more about this so-called triple negative breast cancer. What is it exactly? I don't know if I've ever heard about it. And why is it so difficult to treat?
Yeah, so triple negative breast cancer is and I do want to know it's a more aggressive form of breast cancer. It is more common in Black women. And the reason that we call it triple negative breast cancer is that normally breast cancer tumors have three receptors on them. Those three receptors are referred to as HER2. Before an individual who has triple negative breast cancer, the tumors don't have those same receptors. And so the tumors are less susceptible to traditional forms of chemotherapy. So it can make it more difficult to treat.
And is there any study saying why Black women are more susceptible or at higher risk of developing this type of cancer?
Yeah, I think that's still an area of ongoing inquiry. I mean, we do know that there are some connections between carrying a BRCA1 or 2 mutation and having triple negative breast cancer. And we do also know that it is more common in particular ethnicities. Um, but to my understanding, scientists haven't definitively determined what the trigger is. And so, if I can make one more quick plug to the audience, if you are someone who's had breast cancer or triple negative breast cancer diagnosis, particularly as a Black person, it's so important to think about participating in clinical trial research so that researchers are better able to understand these connections between the diagnosis and who is getting these diagnoses.
That's a good point. And what about like self exams and mammograms? How often should men and women be doing this?
Yeah, so a few things. Generally, there's definitely some debate between uh, societies as to whether mammograms should start at age 40 or age 50. But the caveat is that we also know that the data on mammograms, when they should start, is generally based on data from white women. And so when you start mammograms at age 50, you may miss some diagnoses amongst Black women. And there's been at least 2 professional organizations who have recommended that all Black women at age 30 have a conversation with their primary care provider or PCP about breast cancer risks generally. And the other thing I want to note is that if you have a mom who's had a breast cancer diagnosis, technically your mammogram should start 10 years before the age that the mom was diagnosed. So your mom was diagnosed at 45, you would want to have a conversation with a provider about starting mammograms at age 35. My understanding is that when we're talking about the breast cancer risk in men, I see that more when there is a family history or one of these mutations that we've talked about. And so in those instances, I would recommend having a conversation with the provider about the types of preventative screenings you would want to undergo as a man if you are at a higher risk for male breast cancer.
Well, we know October is Breast Cancer Awareness Month, but we know that this is a topic that we need to continue talking about all year long. So we thank you for your time and helping us understand a little bit more about it. Thanks. All right, everyone, we have more BNC Live right after this short break. Don't go anywhere.
Do you suffer from a lack of energy or the draining side effects of restless